this part. Hey, it's Dr. Allison, and tonight we're going to be talking about a birth plan. And if you are like me, when I first started out on this journey, I was like, oh yeah, birth plans are important. But the ones you find online and on the apps that we use to track the weeks and the size of the baby, they typically were standardized, and it's like, do you want to clamp the cord, and do you want medication for the pain, and so it was just like bullet points of decisions. And I came across this article in the Pathways magazine that I wanted to share with you guys because I really believe that that birth plan is so much more than just choices that you make. So we've posted this in the comments, but it is the Pathways magazine. This is what the little front looks like. But it's page 32, and they've put together a birth principles workbook. And so excuse me for reading, but I just feel like these words are much better than mine would be. So most women's true desires for their birth are deeper than just the outcomes or the decisions. I found that ultimately, no matter what the individual decision a woman makes about how she wants to birth, most of those desires and decisions are more deeply rooted in how she wants to feel during her labor and how she wants to be treated by the people that are supporting her. Most birth plans center around things like a woman's stance on various interventions, the comfort preferences around the treatment of the baby and the mother, especially immediately following the delivery, and her infant feeding choices. But empowerment in birth and in life comes not from, fighting and just making those decisions. It comes from finding the strength and the grace to accept what is and thrive anyway, because what we know about birth is that it is unpredictable. And so gracefully being able to accept your birth story at the end of the day is really where I want to be, and maybe many of you other moms and dads want to be. So really this dives in, and comment if you can't. Pull it up and kind of really see what the questionnaire is, because what we're doing is we're diving in, we're looking for those principles so that then those choices you can make based on those, and understanding your principles are going to help you make even better choices. But birth principles are based on your fundamental values and your deepest beliefs about yourself and about birth. They underpin your outcome-related desires for your birth. Well thought out birth principles will make your individual decisions around how, with whom, and where you want to birth much easier. So each choice you can just say, hey, does this line up with my principles, with my values? And that is a place where I want to do, or I want to be, is to be able to make those decisions line up with my values and not necessarily make emotional decisions or circumstantial decisions. And so check out that Birth Principles workbook. I do want to touch on just a couple things. One, this book, I don't know if you guys can see it, whoops, Active Birth. I would highly recommend this book, written in 1992. I think the pictures might be from 1982, but it was such a great resource for really isolating the mechanics. So each stage of the labor is like how you feel, how the baby feels, what's happening to your body, what's happening to the baby. And as it goes through those things, it really will help you mentally cope with those. However, there are a few decisions to be made. So Dr. Dan and I have chosen to do a home birth. And we have a midwife that has been catching babies for 18 years, and just a dear woman. I am so excited to go on this journey with her. And it's Melinda McCoy with Veritas Birth Association. And so there were certain things that we didn't necessarily have to talk about, like the epidurals and the Pitocin, because we will be at home and those won't be options. But I did just want to bullet point a few of the things you still have choices on making if you choose a home birth, but then also some of the pros and cons and why we chose each one of our decisions. So check out this movie called Why Not Home. Whether you've had 12 home births or the idea of a home birth is the craziest, crunchiest, silliest thing you've ever heard in your life, Why Not Home is a really neat documentary of a ER doctor, an OB doctor, and a nurse practitioner, and why they chose to do a birth at home. So let's see. Cord clamping. This is something that's really important, and if you checked out your baby abs, it's one of those things like, hey, when do you want to clamp the cord? My first thought goes right back to undergrad when I was at University of Cincinnati, and it was a very cold winter, and they were doing a blood drive, and you got a free sweatshirt if you got a blood drive, or I mean, if you gave blood. Here comes that pregnancy brain. So I definitely decided I wanted to do that. I was one of the first, 50 to sign up to get this sweatshirt. And when I went in, they said, hey, go ahead and eat a snack. I thought a little granola bar was going to be sufficient. Unfortunately, I was also at that time of the month, and so I was already losing a little bit of blood. But I'm telling you that after I gave that blood, they were waving salts, and not because I was nauseous or like scared of the needle or anything like that, but I had lost so much blood that they were waving the salts, keeping me awake. My roommate literally had to walk me, like help me to the car. I went to bed at 5 p.m. and didn't wake up until the very next day, and even then I was still very nauseous. So we have these reactions in our body because I didn't have enough blood in my system. Like, that was the worst possible feeling. I never want to feel like that again. Well, come to find out that research shows 1/3 of your baby's blood is in the cord and in the placenta. So if that baby comes out and immediately that cord is cut, your baby loses 1/3 of their blood. Imagine how they're feeling. So one of the things that we have chosen to do is wait on the cord clamping until the cord is done pulsing. And then it's really cool. You don't even, at some points, you don't even have to clamp it because it clamps itself. Like, God put that innate intelligence inside of us. The other thing that we want to do is wait on the placenta to come out. That can take up to an hour and very safely. So many times when you're in a situation like a hospital or maybe even another situation, they do try to rush that process. And if you're stressed or the baby's not able to nurse or latch properly, I mean, lots of different factors can affect your ability to continue that 3rd stage of labor and expel the placenta. But we are going to wait on it. We're going to wait on it and wait till it's done pulsing, make sure the baby gets all of their blood. The studies are showing that those babies are more alert. They're able to connect better, they cry less. The other thing we're going to do is we're going to have the placenta encapsulated. And this is kind of a new, well, no, I don't even want to say new thing, because maybe we're just creating more awareness about it. But one thing we know about the placenta is, yes, all animals consume it and they lick it off of their young, but we as humans are different. However, there's amazing benefits with ingesting the stem cells in the placenta. And so what happens is someone will possibly steam it, maybe even with some herbs, dehydrate it, put it in a capsule. So that is one of the best immune boosting things. And rather than diving into the research, because a lot of the research I've read it and they're like, oh, there's no studies that confirm that this is helpful. Case studies is really where you want to find it. You want to find those moms like, hey, I started fighting like something off, like a virus, a bacterial infection, whatever it is. I took this and I was done with it in 24 hours. I believe that there's wisdom in that. So good friend Katie Quinn is going to do that for us. So we're going to tag her in the comments as well. The other cool thing is it can really help prevent and support your body to prevent the postpartum depression. It can also support lactation. So sometimes I know there's different herbs that she'll put in there, and just to increase your milk supply and to help you with that process. So speaking of postpartum depression, one of the reasons that I would choose, even if we were having a hospital birth, but one of the reasons I would choose to not have interventions like Pitocin and epidural is for the sole reason that those synthetic drugs that we put in our body are going to interfere with the receptors of accepting those hormones, because we have this beautiful cascade of these hormones. I believe when Melinda and Katie did a workshop, a home birth workshop, they talked about it as the hormone cocktail that our body creates. And there's such innate wisdom with that that helps you connect with your baby, bond with your baby, accept the whole story of your birth process. And so we know that Pitocin, the epidural, as it can ease some of the pain, it can also desensitize some of the nerves so things can slow down. So then they use the Pitocin to speed up the labor, and it can just be this vicious cycle. One of the things that I read in my book was just some bullet points, about the benefits of active birth and how it could decrease your need for medication. So we know that birth is painful, and a lot has to do with our perspective on that pain, even the verbiage that we use when we're describing the pain. But when you're able to move around in a way that supports your body and is just instinctive, you are going to have less pain. Like if you're in a painful position, you're going to move out of it. You're going to move into a different place where things can function differently. Gravity can help. It can assist you. So there is less need for drugs when you use an active birth approach. Discomfort and pain are less. Labors are shorter. Really cool thing is the supply of oxygen to the baby is also improved. So many things that they don't tell us about all of the drugs is they can suppress the respiration of the baby. There also, if you don't use drugs, there's much less need for forceps or vacuum extraction. So those other tools of intervention. And also the secretion of the hormones that regulate the whole process is not disrupted. And that's a really important thing too, whether you're having a birth at home or in the hospital. Check out some YouTube videos on undisturbed birth. They're really hilarious, but some are very good, but there is one hilarious one that actually we'll tag that in one of the other Pathways magazines. But they go through the process, and the hormones that you experience in delivery and while you're breastfeeding are similar to those that you experience during an orgasm. And so what happens is, as people are coming in and they're checking you and they're talking to you, you're getting distracted, and they relate the process of birthing the baby to having intercourse with your spouse. And it's quite hilarious. Like, we know that wouldn't work out, and I don't know. You'll just have to check out the video because it makes total sense and it's really amazing. But so some of the other things, like we talked about perspective and just the way that you speak about the pain during birth, being able to actively move around. Also, your body naturally releases endorphins, and these endorphins are God's little chemicals that help relieve the pain. Massage can help. The water birth or the tub can help. And yeah, that's all I have to say about those drugs. The other thing that I thought was really funny is we always think and we see on movies, like when the water breaks, and a lot of people even ask, like, oh my gosh, when the water breaks, does that mean the baby is really coming? It does not mean the baby is already coming. And one thing that a midwife or possibly some doula's philosophy will be that once your water breaks, that doesn't mean we need to check you every hour, because when the doctor tells you that there's more risk of infection after the water breaks, that's because they are checking you multiple times. So you can make that choice. Hey, I want to be checked, or I don't want to be checked. And in a way, it would be kind of nice to know, hey, how are we progressing? How are we doing? Do I need to work harder? Or what's going on? But it's kind of like the kids in the back seat, like, are we there yet? Are we there yet? Are we there yet? So one thing that we've chosen to do is, even if the water breaks, we're just going to let the natural process happen. And we don't want to do multiple checks. We're just going to trust our body. And I say our, but my, I don't know. We're in this together. The good news is I have a good teammate. Okay, so last thing I want to share with you. How long are we at here? I don't want to bore you all, but
over 10 minutes.
Oh my! Well, the good news is it's Facebook. You can turn it off if you don't want to listen anymore. So what I did was I wrote out kind of my idea of my birth plan, just really breaking down, and I was able to put it together because of going through this book. But stage 1, that's when I want my mom there, and I know just like I've made a couple notes. Okay, this is when the contractions are this far apart, and they're probably about this intense. This is when I want my mom there, and I made a list of the snacks that I wanted, and I wanted to hydrate myself. Well, I'm trying to stay hydrated all the time because, well, you just never know when this little human is going to want to make an appearance. And then I also wrote it out during the transition stage where I wanted to be in the house, when I wanted to call Melinda, and some of the things that I wanted to focus on. I wrote out I know that my body was made perfectly for growing this little human and also bringing him into this world. I will quiet my mind. I will focus on the end result. I will breathe. I will picture every hormone and contraction and reaction slipping beautifully into place. And there is something called the fetal ejection reflex. And I was teasing my husband. I was like, you remember that from boards? But it truly is. It is a reflex that we have. So if you are waiting until your body is ready to push and you're pushing and you're acting with those contractions, they are going to be much more productive. And so, yeah, that's my plan. I am going to, probably this weekend, write out some affirmations that even if I can't read them, if I need someone else to read them, they're going to be there. And I know that those words, because they've come from a deep place inside me, are something that are going to carry me, and that will just remind me to stay in that place and just to trust God, because I know that He's going to keep us safe. So thanks for joining us, and I hope you enjoyed this information. Again, check out the Birth Principles workbook that we're going to tag on here. So hopefully we'll see you next week if we're not pushing the baby out.